Good morning, everyone. I'm Noor Marshah, prosthodontic resident at Riyadh Alam University. I'm here today to present my topic about the shade selection for indirect anterior restorations under supervision of Dr. Mohammed Al-Rafi'i, the Dean of the College. Why I choose this topic? Because of the difficulty of matching shade and translucency in restorations of different thicknesses. The challenging when a veneer restoration has to be fabricated next to anterior crown. My topic outline for today: introduction, guidelines for shade taking, factors to consider, management, clinical case, and take-home message, finally differences. For the introduction, we know that the shade matching for indirect restorations of ceramic anterior restorations with different types of restoration has always been a challenge for clinicians and dental technicians, and the preferred smile has always been the request for many patients. And also, it's not only to take a shade, and it's not only as simple as possible. There's many factors that affect taking the shade between crowns and veneers for the anterior dentition, especially when the apparent teeth present variations in stump shades. Matching a veneer in the aesthetic zone is one of the great clinical challenges. We have three factors to have any color. First, the light source, the object, and the observer. Okay, we know that dentin is considered the primary source of color, and there's many elements that affect taking the color, like hue, value, chroma, translucency, opacity, light transmission, scattering, and metamerism, and finally the fluorescence. So the appearance of teeth is mostly determined by how light interacts with the surface. We know that communicate information to our laboratory can be greatly improved by learning the language of color. In practice, the corresponding try and paste of the resin cement can be used to evaluate the color matching of restorations and predict the final aesthetic results. And now we're going to talk about the guidelines for shade taking for crowns and veneers. If the crown and veneers are combined in the same arch, it's difficult to obtain a shade match and similar optical properties between the similar feldspathic veneers and zirconia core crown. So, we have to know that lithium disilicate provides a distinct advantage in translucency over opaque zirconia. So that's why we have to put guidelines points to differentiate between crowns and veneers while taking the shade color. If the crown is implant or tooth structure, the veneers preparation, the substrate, the materials that we use, the cementation that we have color to choose, and stump shade, and also the lab technician. We're starting for the crown. For the crown, if the crown is sound or endodontically treated teeth, colored or discolored, or implant. If it's implant, for example, that's important that the restoration thickness depends on the amount of tooth core reduction, and the background is related to tooth core foundation. So to match both restorations, the screw retained restoration veneer is built up in the same manner as laminated veneers. And this situation becomes more challenging when a veneer restoration has to be fabricated to next anterior implant crown. And now we'll know more about the preparation. The preparation over reduction will increase ceramic thickness, and that means that will reduce the translucency. The use of zirconia substructures as a core for ceramic crowns has provided an aesthetic advantage over masking darkened metal cores and framework while providing high flexure strength. That means when we are designing the monolithic restorations, we need minimum thickness of 1 millimeter for labia surface to max any discoloration. We can see here in Riyadh Alam University how we can choose okay. A minimum zirconia thickness of 1.1 millimeter are essential for color match. Newer generation of all ceramic systems and adhesive cement allow dentists to use minimally invasive approach and make thinner restoration, maybe 1 to 1.5 millimeter. So we can see here how the restorations can be, the color of monolithic restorations may be influenced by manufacturing of the lab process and background of cement and restorations features. We can see here my dental lab office how it's going to make the translucency, thickness, shade surface, textures, and glass and contour. What about the material of the crown? Polycrystalline zirconia ceramics may be more challenging than feldspathic and lithium disilicates. Why? A thickness between 0.6 and 1 millimeter is suggested for masking colored background. Okay, we can see here What about monolithic zirconia? Represents that higher color changes with silvery metal backgrounds than the coppery metal and tooth-shaped background. As Bakshi et al. Reported that an opaque resin cement improved the masking ability, but color masking doesn't mean that color matching will be done. So we cannot mask a stump shade if we don't know what we are masking and where. This is the underlying between a beautiful smile and so cosmetic smile, because a stump shade is very important to take it after preparations are completed, and there's no effect of the stump shade if we have a thickness of zirconia more than 2 millimeters. And now, the importance of communication between patient, dentist, technician, as well as the use of shade matching guides, diagnostic wax-up, and photographs to develop exceptional aesthetic restorations. Will also the ceramist will verify the stump shade after porcelain firing to ensure the proper color chroma and translucency. What about now for the veneers? For the veneers preparation, we have to know if we will choose a prepless veneers or traditional veneers preparation. Okay, when we increase the thickness, that means we'll decrease the translucency. We have to make sure how many millimeter we have to do preparation, what kind of material and thickness we have to choose and send it to order lab job. Now, we're going to talk about the substrate of the veneer. It's very limited masking capacity because it's a limited thickness. And what about the materials of the ceramic veneers? Lithium disilicate ceramic materials enable layering strategies, but their physical and optical properties must be understood. Lithium disilicate has high strength, 400 megapascal, and variable translucency, and it's similar sometimes to superior to lucite reinforced ceramics. Its optical properties varied between high opacity, medium opacity, low translucency, and high translucency. So the selection of the cement is critical to success, and why? Because most of these restorations only lack the retention of resistance of the conventional restorations, but also very thin, between 0.3 to 0.7 millimeter. So the cement is very critical. Okay, what about the stump shade? Why resin cement, stump shade tooth can be very important and can be managed with understanding of color shade, communication, proper tooth preparation, and ceramic lighting techniques. So the not discolored stump shade, can we use it as a correct colored canvas for discolored stump shade? And now, the most important thing in the beginning of all porcelain restorations lies in stump shade, okay? Because we can save time and we can save money by eliminating reshades, remakes, and chair time. Okay, for the stump shade, if the stump shade of all ceramic restorations, except for the zirconia, not recorded, so what will happen? It will become a different shade because when placed in the mouth, because we'll find a difference between the maxillary center incisor and the crown. And also we have to know that there's the light transmission of the crown is different of the light transmission of the veneers. And now, we can see the dental lab work. It's dental lab technician responsibility to remain reduction about the lattice material and education about last material and techniques for aesthetic longevity and comforts. And now we're going to talk about the factors to consider. We have many factors subdivided into 4 categories: related to dentist, the factors related to environment, related to materials, and related to patients. What about the factors related to dentist? We have subdivided into 2 groups: under control the dentist and not under control the dentist. What that mean? That mean the factors under the control of the dentist: color science, timing of the shade, position of the patient, choice of shade guide, and holding also the shade tab. So, while taking the shade selection, neutral gray is an ideal background for shade selection. Sorry. Factors under control of the dentist: morphological details and surface texture, translucency, topography of a tooth, shade stump, and all of these should be recorded and understood before communicate with the dental lab. You have to know how to do curving, how to do wax up, and you have to know how to check the details when you deliver the case from dental lab office before try it to the patient. Okay. What about if you have to make this artificial apple simulating to this shiny smooth apple? It's not only hue, chroma, and value that should be matched, but also the surface texture. It should be matching to get a copied match too. Okay, so this is a suggested form for the shade selection. And now what about the environment? The factor related to environment, we have to understand the quantity and the quality of the light source, metamerism, the contrast and the glare, color of the furniture, walls, and patient clothes and makeup, okay? And there's two methods to take the shade by visual shade matching. It's very common and the most common of the shade selection. And the instrumental shade matching, we can see that there is a limitation of this one because these devices measure limited area of the tooth, okay? And now we're going to see the factors related to patients. Patient education is very important, and also the temporary prosthesis. When the patients go at home with temporary prosthesis, the comments of people may affect the acceptance or rejection of the prosthesis. So don't send patient with mocha-up, okay? And patient personality is also important. What about the challenges that we face during taking shade restorations? We have to understand how many words do we need to take to describe these teeth in written form. So it's very important that the practitioner needs to develop their written graphic and photographic communication, okay? And also, don't take the picture, what patient saying yes, maybe, or no. You have to put your camera lens 90 degree on the smile, okay? To take the right texture and right tooth surface reflected the light. And then we're going to see how it's important that we have a good magnification at dental office and take care of all details at the clinic. And also we have to know that dental photography, dental technology tools like PowerPoint, software, and Keynote allow the planning and possible treatment, communicating with the patient and dental lab office. So now what about the management? The management for us, it's to understand the color science. We know that Mansell color system, the hue, it's the actual color. That means red, yellow, green. And the chroma, it's the saturation of the color. That means if we have light blue and dark blue like this. And what about the value? The value of the brightness or darkness of the color. And our eyes see the 380 nanometer and 700 nanometer. This is called the visible spectrum. And now our eyes cannot differentiate between hue and chroma, okay? There is a differentiation. We can see it on 22 and on 22, the tooth 22, there is a difference in value. It's more brightness. So our eyes can differentiate this the value. So the value is the most important dimension of the color. And now what about the shade guide that we have at the clinic? We have to understand what kind of shade guide we have and how we can use it. Okay, the Vita Classic shade guide is the most common. And what about the hue of the shade guide that we have? A, that means the hue is orange. B, the hue is yellow. C, the hue is yellow-gray. D, the hue is brown-gray. Okay, we have A1, A2, A3. That means when we increase the number, we increase the chroma. Okay, and then when we have B1, that means its highest value. What about the C4? C4, that means lowest value. Understood now for the hue and chroma and value? You have to go back and read more about it to understand it, because it's the key for your successful restorations. Okay, what about if we have material and we have light, how we can choose the best material translucency? Okay, when we have a material and light, the incident light, if it transmitted totally, that means transparency. If it transmitted with gray color, that means translucency. If it doesn't transmit it, that means opacity. So increasing the thickness of these tissues and material increase their opacity and decrease their translucency. And now, don't forget to put your shade tab, okay, incisally when you are taking a photograph also. And what about the clinical cases? We are going to see together the clinical cases at my dental office. You have to let your patient explain their desires before starting. And this female patient wanted her centers to be closed diastema and to be the matching shade and shape. And this is after preparation, and that is the impression. Don't forget to document all the steps during your work and send every details to your dental lab, because you can see the complete stained and glazed monolithic zircon disilicate. And during our work, and okay, we can see here acid etching with hydrofluoric acid, and alumina and zirconia do not fall within this classification. Okay, and during the preparation for our restoration to be cemented in the patient mouth, we can see the lithium silicate, veneers and the crown were fabricated and do cementation. While doing the cementation, try to gently remove the cement in a gel phase, okay? Don't try to remove it by hand piece, because it will affect the margin and you will have this color later because of the rough margin on the restorations that you have. This is the final result of my patient. Okay, you can see that all the teeth were restored by pressed ceramic, IPS and press restorations, with the opaque coupings provide the same underlying color effect with the adjacent teeth. It's only for the 4 anteriors, 2 crowns and 2 veneers. Okay, and now it's very important to know the dental lab work and how he's going to stain the case. We can see here this colleague, I choose to put partial veneers for this case, and this is the case after. Okay, how it's going to be like this? We have to understand how to do the minimal preparation, and we have to know how to document and send all the details to dental lab. And it's no matter to try in the case 1 time or 5 times, it's okay, just to get this beautiful smile. This is in try-in. We can see a little differences in try-in, and I try to put a neutral resin cement just to fabricate it as the tooth color. And now this case, she wanted her 2 centers to be matched. I removed her old restoration, and this is the preparation for that case, and this is the try-in. Okay, sorry, this is the temporary, and that is the try-in. We can see for the left video that the value is a little bit lighter than adjacent teeth. That's why I choose the neutral cement, okay, to modify the final color of ceramic veneer to achieve a color matching of the final result. And then you can see our colleague here, he wanted his smile to be perfect. That's why he come to make his all teeth veneers, but I suggested to him just to make 4 units, okay, after discussion with his desired. And then this is the final result. And this is the minimal preparation that I did for that case. This is a bride came outside of Riyadh. He wanted his centers to be better. And this is after. I just modified 2 restorations, 2 crowns, and a composite filling for number 1-4. And this is the crowns on the model before try it in the patient mouth. Okay? And that is... it's very important to do try-in, to put resin and try in the color, and taking photography before do the final cementation for the patient. It's your responsibility to let your patient be happy with his smile. Okay, and this is my patient for also 2 centers. It's very important to do mapping, shade mapping for the restorations. You have to send to dental lab office the cervical color, the body color, and the incisor color of your restoration before sending, because you have to make it like the dentition. Okay, this is also for 2 centrals. You can see, and this is after. It's very easy to do a smile for many teeth, okay, but it's not easy to make only 1 crown. For this patient, she has only 1 unit. She wanted to make it the same of the 2-1. That's why I tried to remove this one and put temporary, and I tried just to make her taking protocol about the gum, just to reduce the length of the zenith point to make it like adjacent approximately. And this is the final result. You can see how the surface texture, hue and chroma and value is almost the same. And this is very important to understand that value picture, we take it in a white and black photograph, okay, to know the brightness of the restoration if it's matching. And this is the final result for my patient. And we can see here the case 2 about the mapping the shade, how it's important to make the same translucency for the adjacent. And don't forget to take a shade before doing ear preparation. For my take-home message, I want you, just to know that the ability to translate knowledge from brain to brush to mouth is becoming a lost art with the advances in CAD/CAM technology. And more details we have, the better of the patient, clinician, and technician will be all work as a teamwork to produce the best aesthetic outcome. Understand your patient desires and needs. And don't forget to do color mapping, and don't forget to send shades, textures, translucency, and contours. And like this, okay, it's never mind to draw on paper just to let your lab know exactly what you want to do. Lithium disilicate crown and veneers restorations offer promise for overcoming many of obstacles faced with zirconia. Being able to recreate nature is not only limited to dentition, but also to the tissues, okay? The gum and the gum color, it's very important while fabricating the shade of the restorations. It's time to improve your skills and knowledge in a world that has shifted toward cosmetic. And this is my references, and thank you. For the questions that I received on my e-learning, is there any impact to change the thickness of the crown on the final color? Yes, we can change the color when increasing the thickness and choosing the material of the zirconia monolithic, low translucent, different for the high translucent monolithic zirconia. And also in case of combined anterior crowns and veneers, how can I overcome the challenges in shape matching? Okay, I think that I explained it well in my lecture, but you have to differentiate between the material of the crown preparation and cement with veneer that you are fabricating in the anterior dentition. Is the shade selection will be different with patients have pigmented gingiva and need the pigmentation? Yes, it's important to understand it's not only the color of the dentition, it's also the tissue color, and you have to know how to fabricate the right color that not affected the contrast, okay, between the dark gum and light teeth, okay? Try just to do balance. What the effect of ceramic thickness and resin cement shades on the color matching of ceramic veneers in discolored teeth? It's yes, in veneers the resin cement it affect, but in crowns if we have thickness more than 2 millimeters, the resin cement will not.